Well, welcome back to In Focus, and we're joined now by In Focus health correspondent Lino Madu with very important information on the effects of tuberculosis.
Yes, indeed. Tuberculosis is highly infectious and usually affects the lungs, but it can spread to other parts of the body, including the eyes. Dr. Robert Copeland is an ophthalmologist here in Washington, D.C., and travels to Africa to educate doctors about the dangers of TB. Jackson Vunganyi has the story.
Tuberculosis is one of the deadliest diseases in the world today, with a third of the global population infected and nearly 9 million new infections each year. Active TB most often affects the lungs, but it can also affect almost any other body organ. Dr. Copeland from Howard University Medical School is an ophthalmologist who has done extensive work in Africa. He says that one of the organs that can be affected by TB are the eyes.
It can cause all untoward effects to the eyes. It's one of the great masqueraders. It can cause your vision to go down, and it affects all parts of the eye, from the cornea to the lens to the uveal tissue and the retina.
People with TB disease will need to take several types of drugs to get rid of the bacteria in their body. Such drugs will efficiently destroy all of the bacteria and prevent them from becoming resistant to drugs.
You see someone that you think is just positive, does not have any active, you give them a first-line drug. Individuals that have active disease, you give them second and third-line medications, and you like to start as quickly as possible. Once you make the diagnosis someone has active tuberculosis, then you want to start treatment. And treatment's up to a year to 2 years that you'll treat an individual.
However, when the first-line drugs are not effective in fighting TB, the patient is then prescribed a second set of drugs.
Sometimes you have to use a combination of medications because you have individuals in which you're not getting a response to the medication. It's just like anything else. You have resistance, you have different susceptibilities of medications or antibiotics to the tuberculosum. Okay. So the tuberculum is not responsive to one medication, so you use combination medications to eradicate this infection.
Dr. Copeland travels to various African countries on mission trips at least twice a year. One of the objectives of his mission, he says, is to empower local medical workers by providing them with the necessary skills to cater to the medical needs of their communities.
One thing we try to do, we try to empower the individuals when we go over to the countries. When we do surgery or we do anything over there, we take the doctors, the nurses that are there, we educate them by giving them lectures, and then we give them a practicum where they actually work with us to learn the skill transfers that we're giving them so they can be able to take over when we're going. So a mission trip with me means that I'm empowering the individuals that I'm going over to do and to see. And we've been very, very fortunate both in Ghana and Ethiopia and also in Egypt that individuals are ready to learn, and they are helping their people by learning these skills to be better physicians and healthcare providers.
For Voice of America, I'm Jackson Vunganyi.
Well, let's have more now on tuberculosis from Dr. Jerald Sadoff. He is the President and Chief Executive Officer of Aeras Global TB Vaccine Foundation. He joins us now by telephone. Dr. Sadoff, welcome to the program.
Oh, thank you.
Many reports have shown the deadly combination of HIV and TB. According to you, what needs to be scaled up? Will that be a better treatment of HIV or a better prevention of TB from developing in HIV patients? What do you think?
Well, of course, we need to treat every HIV patient with the drugs that are available, and that means we have to identify them. But once they're identified, I think the more important thing is to make sure that those that have TB are prevented from developing the disease. In the developing world, almost 80 to 90% of people that have HIV, even higher than that, have latent TB. And then the latent TB reactivates at a very high level in these individuals as their immune systems become weaker and weaker. So that if they have a relatively immune system with CD4 counts around 450, the rate is about 5%. And as the CD4 count drops to less than 50, the rate goes up to almost 30%. So you can see that as their immune system weakens, with the HIV taking its ravages on it, the TB then reactivates and takes over, and that's a leading cause of death in these patients. So the answer to your question is I think we need better prevention of TB in these patients.
Now, for many years, the BCG vaccine has been used to prevent tuberculosis populations from TB infection. Now, however, with the HIV virus, more and more people are developing TB, of course. Can you elaborate on the efficacy of the BCG vaccine as of today in light of the HIV pandemic?
Yeah, the BCG vaccine generally does not have much of an effect in adults whether they have HIV or not. A recent study from well, not so recent ago, but the latest study in a very large number of people from India showed that BCG vaccine had no effect at all in adults. And so it's not surprising that HIV in adults, the BCG vaccine has no effect when they've been given it at birth in preventing TB in those individuals. Of course, it's even worse because BCG vaccine in infants that have HIV can actually cause some serious problems, and the WHO, World Health Organization, recommends that BCG not be given to children that have HIV, so it can't be used in those children for prevention of TB.
So obviously there is a need for a vaccine that will be more adapted to the realities of today. Tell us about the vaccine that is being developed by Aeras. Is it specifically to address HIV-infected people, or will it be suited for everyone?
The vaccines we're developing will be suited for everyone, including people with HIV. We're making a new BCG called a recombinant BCG that we hope will be safe in infants that have BCG, that have HIV, and also in adults that have HIV. And then we're going to boost that with a series of vaccines that we have made with crippled viruses or proteins plus adjuvants, which should be effective in individuals that don't have TB, preventing TB, and those that have latent TB, preventing it from reactivating, including individuals that have HIV. And all of these vaccines are being designed so that they'll be safe in people with HIV for two reasons. One, because we want to protect people that have HIV from getting TB, and also because we could be giving these vaccines universally to everybody, and we wouldn't know if some of them didn't have HIV already. So it's very important, and we've designed every vaccine we have, and we have 6 of them, 1 recombinant BCG and 5 things for boost, that would all be safe in HIV-infected individuals.
Okay, thank you so much, Dr. Sadoff. That's all the time we have, and good luck in your work.
Thank you very much.
And that's all about
Wow.
TB
Very
vaccine.
informative.
Yes, it's important to know because BCG for a long time has been used. I believe I got a shot of it. Maybe both of you have gotten it. So.
All right. Well, thank you so much, Lenore. As always, very, very informative health segment there. Now, please be sure to watch for Lenore Madu every Tuesday and Thursday for the latest health news right here on In Focus.
And for more information on this stories, go to voanews.com/TV to Africa.